Elmore McConnell, the body transformation expert. I'm coming to you to talk about exercise and type 1 diabetes. Alright, so anytime that you're going to start any type of program, especially if you're going to be a type 1 diabetic, you want to consult with your doctor first. You want to go ahead and find out about your glucose levels. What are the optimal glucose levels for you before, during, and after exercise? I'm pretty sure he's going to have some input. Now, when you do start an exercise program, make sure you let your trainer know, because that's very, very important. All my clients always let me know if they're going to be type 1 or type 2 diabetics. Now, the reason for that is during exercise, compared to the diabetic and the type 1 or type 2 that they are in their body type, either their blood sugar is going to spike or it's going to drop. And it's going to be based off their glucose levels that day, if they were high or low, or if they had a snack before, or if they're going to be using a pump, or if they use any type of tablets or injections. So it's going to be based off the activity of the exercise, the intensity of the exercise, and then also the duration of the exercise. So if it's high intensity, during exercise, depending on the person, their glucose levels may spike, or their glucose levels may drop. And that's even after exercise. So you always want to make sure that you keep a log to monitor your numbers and keep up with what's going on the inside of your body. Some of the other things I wanted to cover, yes, you can have a carbohydrate snack before your workout if your glucose levels are, what they say, usually less than 100 milligrams. So go ahead and have some type of snack that's going to give you about 15 grams of carbohydrates to increase your glucose level before exercise. All right. One thing to always remember, glucose is what your body uses for energy. So that's the reason why you need to make sure that your glucose levels are at a certain point, throughout the day or before or after exercise. But insulin is the most important thing, because if your body does not produce insulin, you have nothing to offset those glucose levels. All right. Again, this is Elmore McConnell. I'm not an expert in this, but I just wanted to make sure that I spread the word when it comes to exercise and diabetes type 1. That there are some precautions that you should take during your workouts, before your workouts, after your workouts. You should always bring some type of small carbohydrate if you're going to have to take something by mouth, just in case if the workouts are intense. And definitely you're going to be pushed when it comes to my workouts. When it comes, just because you're going to be type 1 diabetic, I won't take it easy on you, but I'm mindful of your situation, and I'm mindful of the intensity levels, the duration, and then also how much rest I like to give you. So again, this is Elmore McConnell, the body transformation expert, and I'm Atlanta's top personal trainer.